Okay, so dilated cardiomyopathy, this is a condition that we see mostly in dogs, and the real classic breeds are your Dobermans and your large breed dogs, so we can see it in rottweilers and a few other breeds as well. Now, there can be some obvious causes to it, or when I talk about obvious causes, potentially some nutritional deficiencies can cause it, but in reality we don't understand a lot about what causes this disease, and in most cases it's what we call an idiopathic disease, so we don't know what triggers it. But basically what happens with this condition is, for some reason, the heart muscle basically stretches, and so instead of having a nice well-proportioned heart, the heart stretches and stretches, and it becomes a much less effective pump at that point, because the muscles are basically have stretched, they don't pump or contract as effectively, and so we end up with really a heart that's not doing its job properly. Now, the stretching of the muscle can cause other problems, so as well as not contracting as strongly, as the muscle stretches, it effectively becomes a bit leaky when it comes to the heart's electrical impulses, because the contraction at the heart is basically controlled by electrical impulses, and the main trigger for those is a point in the heart which basically sends out an electrical impulse around the heart, and we get a nice controlled beat. If the heart muscle is really stretched, then it can start to leak and trigger those electrical impulses elsewhere, or even constantly trigger those impulses. And so instead of getting a nice controlled contraction, we end up with fibrillation. So basically the heart's just contracting and fluttering away. And at that point it becomes very ineffective, and that's where dogs can collapse and show quite severe signs of heart failure. So to diagnose this condition, what we're really looking at is an ultrasound. It's very hard for us to tell this condition is happening without an ultrasound, and that makes it quite a frustrating condition, because the first thing a lot of people know about this is when the dog's showing signs of heart failure. So the dog's becoming very weak. There might be a build-up of fluid in the abdomen or on the lungs, and so the dog might come in coughing. And it's at that point where we might listen to the heart, and we might hear an arrhythmia, but sometimes these hearts actually sound quite normal when we listen with a stethoscope. But when we use ultrasound, the ultrasound will show us very large chambers, and also we measure something called the fractional shortening, which is basically measuring how much the heart's contracting, and we know roughly how much it should contract with each beat. And so if we're looking at the heart on the ultrasound and it's just doing tiny little contractions, then that confirms our diagnosis of dilated cardiomyopathy. Now, there's a few things we can do to manage the secondary signs of this, but once again, it's generally not a treatable condition. So what we look at doing is using medications that might help the heart contract stronger. So we might use a drug called digoxin, or we may use pimabendan again. So those sort of medications, and certainly if we find this in a dog before it shows signs of heart failure, pimabendan is definitely our treatment of choice, because it's very well tolerated and has been shown to prolong life. But once they're showing signs of heart failure, then we need to really be looking at the whole picture, and sometimes a combination of drugs is needed. If there is an arrhythmia, we may need to look at things like antiarrhythmic medication. In a person, this is the sort of thing where really a heart replacement is needed. So yeah, we can quite often get these dogs back to a reasonable quality of life, but this is a progressive disease and quite a nasty one. So yeah, I mean, ideally early detection and treatment is ideal, but like I said, it's very hard for us to pick up, unfortunately, until we have signs of heart failure. So some people might advocate routine heart scanning of large breed dogs. So things like your Dobermans or your rottweilers may be starting at doing an annual cardiac screen once they're 4 or 5 years of age. The big question with that is how much benefit do we get versus how much stress do we put the dog through if we need to sedate them to do the scans. It's trying to balance off that kind of whatever we put the animal through versus the benefits that might come from it. So in some cases it might be appropriate. A lot of the time it really is a case of we see them when they have problems, and we manage it as best we can.